Welcome everyone. Just waiting for our numbers to come in. We'll give it another 30 seconds or so. Okay, it's 12:30. We'll get started. So good afternoon, everyone. My name is Julie Allardyce and I'm one of the facilitators from our EMPHN General Practice team. And I would like to extend a very warm welcome to you all today. Next slide. Thanks, Tanya. Eastern Melbourne EMPHN acknowledges the Wurundjeri people and other peoples of the Kulin Nation on whose unceded lands our work in the community takes place. We pay our respects to Aboriginal and Torres Strait Islander cultures and to elders past and present. EMPHN is committed to the healing of country, working towards equity and health outcomes and the ongoing journey of reconciliation. We recognise and value the knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them, and celebrate their strength and resilience facing the challenges associated with recovery. We acknowledge the important contribution that they make to the development and delivery of health and community services in our catchment. Next slide, thanks Tara. Please be advised that all attendees are on mute, and if you have any questions, please pop them in the chat box and we will answer them all at the end of the presentation. A link to the recording of this presentation will be sent out in an email with some other helpful EMPHN resources that should be very helpful for you. And the whole series will then be put on our EMPHN website. So I'd like to introduce Tanya today. So we are very excited to have Tanya present this first webinar in our series of carefully curated topics aimed at educating and motivating you wherever you are in your practice management journey. We are fortunate to have our very experienced presenter, Tanya Worrell, delivering this informative series for us. Tanya has run her own business as a practice management consultant since 2004, providing support to GPs, specialist and allied health clinics. She also works as an accreditation surveyor and a trainer assessor for medical reception and practice management courses. Tanya currently manages 3 practices in the Dandenong Ranges. So thank you, Tanya. You can start your presentation.
Thanks, Julie. If we can just go to the first slide, thanks. Performing. And the next one, thanks. I just wanted to acknowledge the support of Trophy for these webinar series, and this will be Trophy represents transforming research outcomes into the primary health interface. It's an initiative involving some of the universities and the Windermere Foundation, and I thank them for that. Thanks, Tara. Hopefully this series will be helpful for new or aspiring practice managers, maybe even practice owners or GPs, registrars, or anyone that wants to gain a better understanding of what it takes to manage a GP clinic in this particular environment, and to not only increase your skills in certain areas, but hopefully it'll help by supporting you to learn about what you don't know. Have you ever been asked as a practice manager, what do you do all day? As I thought about it, I've had to cull the list a bit, but, overseeing operations, managing staff, managing the team, budgeting, financial planning, perhaps ensuring legal compliance, enhancing our patient journey, risk quality improvement, implementing innovation, the list gets longer and longer and longer. And for each practice manager, the job description may be slightly different. It could include all of these elements plus more, or it could include only some of them. And it will very much depend on the needs of the practice and the skills of the practice manager. Some people find too that your practice manager's role will change over time. So the most important lesson that I've learned as a practice manager is to constantly assess my scope of practice and be aware of what I don't know. So in other words, I never stop learning. And hopefully that's something that you'll gain from this too today. Next slide, please, Tara. So we're going to look at a webinar series is going to outline those 4 areas that we've advertised, and hopefully you'll get something from each of those. So planning and business operations, human resource management, risk and quality improvement, and customer service and the leadership of a team. Next slide. Thanks, Tara. The first webinar we're going to look at is how we set the framework for our business and your role by developing strategic and operational plans, including basic financial reports that are going to help us in our role. And this will include an overview of financial structures, funding streams for your business. So thanks very much, Tara. Let's start by looking at the scope of a practice manager, and I've tried to categorise them. I've come up with about 8. Now, there's probably things that people would think that we could add to this, or other things that people do, but I've just tried to put them in areas that are fairly broad, but hopefully cover most of what we do. So, as I said before, some practice managers scope encompasses all of them. Some do only a few things, and the roles change based on your experience, based on the needs of the practice, whether it's because external factors change and all of a sudden you need to increase your skills. If you think about 2020, all our skills increased exponentially in that period of time. So the government may change, the healthcare environment may change, or there may be some other factors that change. So take some time now to think about your role and what's in your job description. Have a look at what your limits of authority are, and what do your practice owners or your owner, what do they understand your role to be? And is it the same as what you understand your role to be? Have you ever had the conversation with them about your role? If we look at these areas of scope, we're looking at governance, which is how you run your business, the rules that you outline in your business. Business and clinical operations, how things are done in your business. HR, we all know that side of our role. Planning, so strategic, business, operational plans. And then it might be IT, information management, so IT, privacy, health records, those sorts of things. Then we have the customer journey or the patient journey, and financial management, and risk and quality improvement, which is actually embedded into all our systems, and it should be embedded in our culture as well. Next slide. Thanks, Tara. So today we want to have a look at governance. The RACGP standards, and we're going to mention those a lot throughout this webinar series because I want you to see how what we're talking about relates to the accreditation process. But the core standard 3 is about practice governance and management. Our practice has integrated governance and management systems that maintain and improve the quality of care provided to patients. Practice governance relates to the principles, methods and processes that clinicians and health service managers follow in order to support patient safety and quality care. It also helps you to set, measure and achieve your social, financial, legal and human resource objectives. So that's what the college outlines in the standards. And this definition here is just from the Governance Institute. So as you can see, it's the mechanisms by which the business, the people, they are held to account. It includes ethics, it includes risk management, compliance and administration. And so we need to understand enough about governance to know what that means for our business and what that means in our planning process, which is what we're going to discuss today. For everything we do, and particularly in healthcare, we need to consider governance. It's about patient safety, it's about quality of care, and it's also about medico-legal compliance. Each part of our business is reviewed within the framework of governance, which is our rule book for how we run our practice. This is within too the legal guidelines that we need to consider. We need to think, is what we are doing ethical? We need to look at what the risks to us and to our patients are. And we also need to think about, will this provide the best quality of care? So this is what we do with our business and our structures and our processes. We need to consider this on an ongoing basis. Are you aware of how much legislation is required to run a medical practice? A few friends of mine sat down once and put together a list, and at last count we had over 150 different pieces of legislation that govern what we do. These are federal acts, laws, bylaws, regulations. If you think about things like Medicare, finance, tax, GST, all those things, there are acts and rules and bylaws around those. Work cover, employment law, discrimination law, privacy law, IT and data security, etc., etc., etc. So over 150 at last count. Then you need to think about the other things that govern what we do, the standards. So the ISO standards, which are part of the accreditation requirements, the ASQA standards, the safety and quality in healthcare standards, the college standards, codes of conduct that doctors follow, nurses follow. Then there are clinical guidelines. There are all sorts of things that we need to consider to run a medical practice. Next slide, start. Within healthcare, we also have that clinical governance, and that's about our leadership and culture. So the policies and the relevant standards, job descriptions, things that keep that support our leaders, and also that culture that shows us that we want the best clinical care for our patients. It might be meetings to discuss risk, feedback, quality improvements, diversity recognition, disabilities, high risk groups. This is all part of the leadership and culture part of the clinical governance. Then we've got patient engagement, so feedback and complaints management, reviewing feedback, open disclosure policies, patient information, how much access they can have and how. Then we've got risk management, and we're going to look at that in one of our webinars later. That's a really big part of what we do. Then workforce capability and engagement. So our good HR processes, the credentialing that we have for our clinicians and the scope of practice, any training that's mandatory, those sorts of things. Safety and quality systems, we're talking about accreditation, which is part of that, but clinical audits, our policies and procedures, accountability, processes for escalating issues, all those sorts of things. Then we have clinical effectiveness, so the accuracy of health records, Medicare auditing, do they meet the records, meet that requirement, evidence-based care and clinical guidelines, monitoring and improving our clinical reporting. And, we want this built into the culture of our practice. We want these things to be operating automatically in the background and everyone is aware of them. Do you have a no blame policy? Do you review your processes for quality improvement? And so that's why, as you can see, a large part of accreditation is around the governance requirements. Some of the indicators that outline this are: our practice team has the opportunity to discuss administrative matters with the practice principals and directors and management. That's about engagement. Our practice encourages involvement and input from all members of the team. And there are questions around that when you have your accreditation. Our clinical team discusses practices' clinical issues and support systems. So this is about best clinical care for your patients. Our practice supports safety, health and wellbeing of the team. That's about risk. It's also about leadership and culture. And our practice team is encouraged to obtain immunisations. Again, quality and safety and risk. Our practice has risk management systems. Our practice has complaints resolution processes. All these things are about the systems and processes and the culture of the practice that's in place. And then there are questions around research, and this is about having ethical approval for research, having the correct indemnity, and also about how you transfer patient health information to somebody, perhaps as part of research, a third party, that with obtaining consent from patients in the process. So governance requires certain mandatory policies, for example, privacy, quality improvement and consultation, risk management and assessment, mandatory reporting of privacy breaches, triaging policies, social media, email and SMS usage policies, our follow-up and tracking of issues policies, open disclosure, financial billing, infection control, Infection control is a huge part. There's a lot of governance around infection control, the sterilising process, all those things, work health and safety, HR, recall policies. Anything that worries you, that you wish to govern, you need to include in your governance processes and work out what the rules are. Governance also requires some mandatory education that's around privacy, and there's a question in the standards about who has been trained. That's in risk control, so it's about privacy and it's about risk. Work health and safety, infection control, quality improvement, anything that worries you or anything that you wish to govern. So you need to make sure you have the mandatory policies in place, and you need ongoing training in certain areas as well. Next slide, please. So the Australian Council for Safety and Quality in Healthcare, or ASQA, notes that good practice governance is participatory, consensus-oriented, accountable, transparent, responsive, effective and efficient, equitable and inclusive, and compliant with all relevant laws. So knowing the law is important. And if you look at all these requirements, then it's around that team effort. It's about the culture. It's about getting your systems right. So that is your rule book, and ensure that everyone reads the rule book and remind people of the rules and keep the evidence. So it's important that we don't just set up a system and let people go. We need to educate them. We need to ensure they're aware of what our system and our policies and processes are, remind them regularly, and keep evidence where there is an issue with people not following the rules. Creating a culture of good leaders means that we've got a clear vision and we've got goals and objectives that we're working towards together. We have mutual respect, we're supportive of each other, we have a positive working environment and a good team culture. And that's how we get safe and quality care, because everyone is working together on the same page. No one's doing their own thing, no one's going rogue, and we can ensure that the standards are met. Again, accreditation standards ask for certain evidence of this, and that is that all members of the team understand their role in the practice. How do you ensure that? Job descriptions, specific induction processes. Another requirement which can fold into this as well is our practice has performance discussions with each team member. Are they on track? Do they know the rules? Are they following the rule book? Our practice inducts new members of the team and makes them familiar with our systems and our processes. Governance. Our practice has at least one team member who has primary responsibility for leading risk management systems and processes. It's important that one person has responsibility for certain parts of what we do because of the fact, the importance of these, but if we don't have one person responsible, it's often who is doing it. Well, I thought you were doing it. Well, I thought you were doing it. And in the end, no one's really taking that responsibility. So accreditation's asking us for that. Responsibility for someone who is leading risk management systems. And as I said before, a requirement that that person has had some training. So we are having a webinar on that. So if you don't have that training, you can tick that one off for your accreditation requirement if you join into that webinar. Our practice has at least one team member who coordinates the resolution of complaints. Again, this feedback is important about, fixing mistakes, open disclosure, ensuring quality improvement within the practice. Our practice has at least one team member who has primary responsibility for infection control. And as I said, this is a huge area of governance. There are so many rules around infection control that need to be followed. Someone needs to be responsible and make sure the team is aware and follows the rules. Our practice has at least one team member who's primarily responsible for cold chain. And again, lots of rules around cold chain. It's not something that you can just throw someone in and say, let them go. You have to have the rules and they have to be followed. And then responsibility for electronic systems and computer security. Now, that doesn't mean you have to do it all yourself, but you have to know enough to be able to hold your IT company to account. And just remember that you can outsource the work for managing IT and data security, but you cannot outsource the responsibility. So you have to ensure that you have the rules in place that your IT company follows as well. Next slide, please. So let's have a look at planning, because that's where it all starts. Benjamin Franklin once said, if we fail to plan, we plan to fail. So without a plan, how will we know where we're going? How we know, how we are going to get there. So how we know what road we're going to take to get where we want to go. And hopefully taking everyone with us along the way. And also, how will we know when we've arrived? So again, back to the college standards, there are some requirements in the standards for this. So we have a set of criteria that says our practice plans and sets goals aimed at improving our services. So this is what accreditation is about, quality improvement. Then it says our practice evaluates its progress towards achieving its goals. And then there is a requirement for a specific plan. Our practice has an emergency response plan for unexpected events, natural disasters, pandemics, and unplanned absence of clinical staff. So let's start by reviewing your existing plans and have a little look at those. And part of this webinar series, and we'll talk about it a little bit more at the end and give you some hints and tips, is I'd like you to take away from this a little bit of homework. And I'd like you to think about, as we go through this, how you can develop something that you can take back as a practice improvement. So develop a practice improvement plan. Now, you may have one thing from this webinar, you may have a couple of things. So I want you to start to think about that. And also, I'd like you to think of, as we said right at the beginning, a good practice manager never stops learning. So think of a personal improvement plan. So something that you've learned today about yourself that you think, I need to know more about that, or I need to learn more in that regard to improve my skills in that area. So have a look at your existing plans. Do you have them? Are they adequate? And what needs updating? What's working? What isn't working? And the big question, do they meet the governance requirements that we've been talking about? Thanks, Tara. Let's start with our vision. What is your fundamental purpose? Why does your business operate? What inspires you? Where do you want your business to go? This is your vision statement. Do you have one? Have you made a vision statement? Is it something that you've got together and put on paper? Is this vision statement available to your stakeholders, your patients? Is it on your website? Maybe it's displayed in your waiting room. Some examples that I found in healthcare were one vision that said, by 2050, everyone in our community enjoys the best health and wellbeing in Victoria. That's a really good vision to have. Then another one said, we provide holistic healthcare to our community with pride in our work and a commitment to excellence. So that's what the vision is for why they open their doors every day in that particular business. So think about it if you have one. If not, think about what that might be. Then you have your mission statement, which is how will you achieve your vision? This provides a little bit more detail so that you or that your stakeholders will know what you are doing. So some examples again, to be known by our patients, our people and our community as a general practice that really cares. Good mission statement outlining how they want to achieve that vision by being, important in the community. Another mission statement, our priority is to provide high quality care and maintain a healthy, independent community. We have a supportive, inspiring workplace where we are proud of what we do. Being a multi-skilled team, we strive for excellence by teaching and learning, and we work in partnership with our patients and their families. A little bit more detail, but this is how we're going to achieve our mission. And then we have our values statement. So values are the core principles that guide the organisation's actions and decisions, and they reflect the ethical and cultural beliefs of the organisation. So they are how we behave. It's interesting, values generally are single words, but they often have with them some explanation or about defining what that particular word means. So I had a quick look at the RACGP values, and they said one of their values was ethics, and then they clarified what that meant by we are accountable, transparent, and committed. Then they had quality. We are decisive, motivated, and innovative. So as you can see, the value statement can be just words, but an explanation of what that means is valuable too. Are all your employees and staff and tenant doctors, all the people that are in your organisation, are they aware of what your values are? Are all your stakeholders aware? Are your patients aware? Do you display them in your waiting room? Are you game? If this is the behaviour that you say that you hold, you value, is it something you demonstrate every day? Are they part of your new employees pack, or maybe part of the advertisement for your jobs on Seek or wherever? And are you able to be held accountable for them? Thanks, Tara. So, strategic plans. We start with our vision and and we then use that to develop our strategic plan. Our long-term plans are part of our strategic plans, of our long-term plans that direct the organisation, where we're going and how we're going to get there. So it includes the steps we're going to take. A strategic plan gives us a really clear roadmap of what the organisation's future is. And it helps us, it's generally 3 to 5 years. So it helps us make decisions then in that period based on the organisational goals. And it gives us an idea of how we allocate resources, what we prioritise. It increases efficiency and effectiveness because we are focused on the things that are in our plan, and we don't waste time in other things. And we look at, our most critical goals. And then we look at performance and how it enhances our performance, because we're all trying to achieve the desired outcomes and our overall performance improves. And then it allows adaptability in the organisation, so we can respond to changes because we've got a roadmap and we know where we're going. We need to involve the team again. You need to get buy-in. If you involve the team, they're more likely to be engaged in the process and in the changes. You can have a strategic planning day. I know that's what we did in our practice, or half a day. We shut for half a day. You can get a consultant in if you want to help you. You can have input in various ways from, as I said, from all the staff and the people involved in your business. You can have a staff room whiteboard. I've seen it in the tea room. Why are we here? And, staff members can put things up based on what they're thinking at the time. You can have appraisals. You could ask this question in your regular staff appraisals. You can consult your stakeholders, and that's really important part of the strategic planning process. So that is your practice owners, your tenant doctors, your employees, your patients, any suppliers or allies that might be part of your business or organisation. You can even involve your community, particularly if you're a very community-based practice. What are the expectations of your stakeholders? And you need to gather this information to help you with your planning. It's really important, the influence of your stakeholders in all levels of your planning, particularly when setting goals. So how do we consult with them? You can use your complaints register, your feedback surveys, or even your feedback, if you have a feedback box in the waiting room. So it doesn't necessarily have to be a specific survey. It can just be feedback provided by patients or by other stakeholders. You could have a focus group. Brainstorming is a really good way, particularly, in the strategic planning process, getting people together and do that whole brainstorming thing, coming up with ideas. So the process for strategic planning includes obviously setting your vision, mission and values, because if we're going to create a roadmap, we want to know what the destination is. And that is what our vision, mission and values sets. We've got to keep these at our front of mind as we are doing the planning process, because they are the basis for all future decisions. Whenever we make a decision, we look back, does that support our vision and our mission, or are we going, totally off to the side here, and do we need to rethink what we're doing? Then the next part of a strategic plan is the SWOT analysis. So this stands for the strengths and weaknesses, and these are internal in our business. So what are the things that we have? And they could be the strength or a weakness, but you look at things like your staff skills and your areas of expertise. Is there something someone does that is a strength that we could introduce a service? Or are you lacking in skills? So is that a weakness? Your physical space. Do you have enough rooms? Do you not have enough rooms? Have you got enough equipment? Do you not have enough equipment? So that you've got to look at both the strengths and the weaknesses internally. And you have to be very honest. It's not, there's no shame in more weaknesses than strengths, but that's where you can look at what you can improve on. And then you look at the OT for SWOT stands for opportunities and threats, and these are external things. Now, we know government changes can be positive or negative, so they could be an opportunity, they could be a threat. Other businesses in the area, maybe too many is a threat, maybe not enough is an opportunity. The economic climate, and again, this can change. So that's why, 3 to 5 years, you may even have to have a little look partway through at some of these things because they change so quickly. Our workforce, our ability to recruit doctors, clinicians, non-clinicians, whatever, other local services, and also patient demographics. Sometimes they have a bit of an influence on your strategic plan. You might have something that's a really good opportunity, a particularly cohort of patients, say, for example, young families where there's an opportunity for, maternal health things or whatever it is. So think about patient demographics as well. And then you want to have a look at what things are critical to our success. This, most practices would probably include financial viability, but what are other things that are critical to our success? And often that's based on the SWOT analysis. So it might be it's critical for you to provide really high quality care because, you're in an area that's got a lot of doctors around and you want to stand out from the crowd. Patient engagement, it would obviously be on most people's critical success factor. If you don't have the patients, you're not going to get the finances. Your business is not going to survive. Then you want to look at what your strategic objective is, and that gives us greater clarity to our mission and outlines more specifically what we want to achieve. Once we've set our strategic objectives, so how are we going to get there, then we start breaking that down into our goals and our actions and what are the goals and actions that will achieve this. And we want to look at SMART goals. I haven't got time to go into if you don't know what a SMART goal is, but I will give you an overview and we can have a little look at some examples. So a SMART goal stands for specific, measurable, achievable, realistic, and time-based. And then lastly, what we want to do is have an ongoing review process to see that our progress, have we achieved what we set out to achieve, and what are our indicators of success? So just for an example, let's have a little look at a strategic planning goals. One of them might be our strategic objective might be about empowering our people. So one of the strategies to do that is have a values-driven culture. So a culture where driven by our values. And a goal from that might be to promote and reinforce our values and expected behaviour. So that's a goal that's fairly simple, fairly clear. And then from that, we have 100% of our staff have an annual performance review. So that makes that goal SMART. It's specific, it's measurable, achievable, it's realistic, and it's time-based. The annual review, 100% of our staff, that we reinforce our values and expected behaviours. Another strategic objective might be a great healthcare experience. And we want to do that by improving efficiency in obtaining the care for our patients. So the goal from that might be to streamline appointments to reduce wait times by 10% within 6 months. Again, we've got some time limit on it. We've got, you know, a measurement of success. Then we've got financial viability, perhaps as our strategic objective. So we want to improve our financial efficiency, and that will be through reducing bad debt by 50% within 12 months. So when we're doing strategic planning, it's wise to consider sustainability and our environmental impact. I'm not sure, some people come up with that naturally in their strategic plan, others maybe not have thought of it. But just a heads up, there is a suggestion that that will be included in the 6th edition standards for accreditation when they come out next year. It certainly was in the draft. I haven't seen the second one as yet, but we'll see what happens. But is this something you've already looked at, or do you need to implement changes in this area? Now, we may be part, you as a practice manager may be part of a bigger corporate organisation, and that they may set the strategic plan for you. But what you need to do within your own business, within your own practice, is need to share this with your team. Make sure that it aligns with the things that your business and operational plans align with the organisation's strategic direction. But you also may have to consider some unique things that your patients or stakeholders need. And so you have to be aware of that your goals not only meet the strategic objectives, but they actually meet the needs of your specific patients as well. Thanks, Tara. So business plan. This is usually about a year. It can be slightly longer. So this is where we get a little bit more nitty-gritty, and we look at the business, the entire business, and what guides our decisions. It includes marketing, sales, management, operations, and financial. So there is a few things involved in this, and a business plan outlines an overall strategy for the business. It assesses finances and outlines how we're going to achieve the goals and who will be involved. So there's a little bit more detail here than the strategic plan. It focuses more on the practical aspects of the business. It can be used if you're starting a business or continuing changing, adding a new service, whatever. So the structure of a business plan is, as the slide suggests, an executive summary, a market analysis, so that is your data consultation, strategic analysis, service description, operational plan, financial projections, and management team. The strategic plan says why we're here and where we are going, and the business plan says what we will do and how we will do it to achieve the strategic objectives. So it consists of an executive summary, and usually you write that last because it pulls things together, the business and structure, what's being proposed, you know, why will it be successful, and what we need to achieve, financials, those sorts of things. There's a bit of information about the business profile that may be, you know, a discussion or an explanation about your business, the name, you know, what sort of a business it is, what the outline of your business is. Then we look at what we contain in our business plan. So products and services, in our case, mostly services. That's what the industry we're in. But what does your business offer? What are your unique selling points? Who are your potential customers and your competitors? What are the market trends? Those sorts of things. Then we look at customer satisfaction. Define your customers. In a lot of businesses, GP businesses, our customers will be our tenant GPs, will be our patients, obviously, could be allied health providers that work within our business, rent rooms or whatever arrangement you have there. So think about that. And then what type of patient journey do you want? Is that part of your core values, and what level of service do you need to provide to your tenant GP? So you have to look at your customers and the journey for all of those customers, whether it's your tenant GPs, your patients, or your allied health, whatever providers that are part of your customer base. Then we've got to look at a marketing plan. How do you intend to meet your organisational goals through the services that you provide to reach, obviously, financial goals? Who is the market that you're targeting? What are the needs of the market? Do you have a unique selling point? What are your services worth? This may determine how you attract tenant GPs, how you attract patients, how you attract other customers. Then we look at legal and risk. And as I said, we're going to talk about that later on because it's a really big part of what we do. But we want to see, evidence in the plan of an analysis of risk. So what could go wrong and what you might need to do to mitigate that risk. Then our management and operations, it talks about what the structure is in the organisation, who are the key personnel. You might want to include a diagram of the hierarchy. What management and key personnel does your business have, and how do we get the service to the customers? What's the process for that? And then financial plans. To be a viable business, obviously revenue or income must be sufficient to cover the expenses, and with a little bit to reward the business owners for their work, either in fee generation or investing into the practice. So that's what's our profit. So we need to make sure in our business plan that, we have a viable plan that actually generates us profit, not runs at a loss. And then our action and operation and plan, which outlines our goals and what we will achieve on a day-to-day level. What are the activities or the work that needs to be done, and who is going to do it? Thanks, Tara. Part of our business planning includes the financial aspects. So if we're not viable, the doors will not open. So some of the important information that we should be aware of in regards to financial plans is where your funding source comes from and how it will be allocated. You may need to get an idea of what your business structure is, whether it's corporate, sole trader, partnership, company trust. There's all sorts of different ways that businesses can be set up. And there are different requirements for each. So there are different tax requirements, there are different superannuation requirements, work cover requirements, payroll tax, all those things. So you need to make sure that you get legal advice in that area, but it's handy for a practice manager, even if they don't get involved in all that stuff, to have some idea. That helps them with their business plan and it helps them make some decisions further down the chain. Do you provide medical services to patients, or do you provide admin and nursing services to support tenant doctors to provide the medical services through their own business? Perhaps it's a mixture of both. We've had a lot of changes in that space in the last few years. So understanding the legal requirements of your structure and the governance requirements is important to understand enough to ensure there is good governance, or where you can get advice if this may impact on some decisions you're trying to make, whether it's your financial accountant, whether it's your lawyer, whatever. But you need to be aware when you're going to make a decision, what does that affect further within the business structure and, legally, governance-wise. Then we've got our income, and we have various sources of income from general practice. These may be service fees from our tenant GPs. It may be from allied health as tenants. They may rent rooms from us. It might be through sale of products. Some practices may do that. Obviously, patients, so private fees from patients, insurance, others, work cover, organisations that pay for medical services. So we need to understand each of these and what impact they have on the profitability of the business. Obviously, Medicare is a huge source of funding for our patients because Medicare legislation outlines the rules that we need to follow, and we need to be aware of that. Over 30 years ago, when I started in general practice and we used to have the MBS online, which was in a book form, I was thrown that on my first day and said, that is the Bible. You need to know everything in that book. It turns out I didn't have to know everything, but I did have to know an awful lot of what the Medicare rules were. So we need to be aware that there are rules around Medicare that we need to, at least keep looking for, keep digging if we're not sure. Think about, is there a rule I need to know about? The Health Insurance Act in 1973 outlines the Medicare legislation that we need to follow. Because a Medicare benefit is actually payable to the patient to help to cover the cost of health services. It's not a payment to the doctor at all. And bulk billing is when a patient gives their right to the Medicare benefit directly to the person who's provided the service. So it's not Medicare pays the doctor, it's Medicare pays the patient. And when the doctor asks for that money directly, the patient has to actually sign to say, yes, I'm happy to assign my benefit over to you. And it prevents the doctor from taking money from the patient at the same time as bulk billing them. The only exception to that is a vaccine, but anything else is not part of the Medicare guidelines and the Medicare law. So ensure you understand too the Medicare audit process. Ensure that doctors and staff are compliant. Doctors are responsible for their own billings. Staff should never be involved in that. Understand your obligation in the shared debt recovery scheme. So if doctors do not do the right thing and are audited by Medicare, who pays back? Do you have to pay part? Does the doctor have to pay it all? Understand how your agreements are set up. Get legal advice on that if you need to, but just be aware that there may be financial implications for if the auditing process is found to be wanting and the doctor's billings need to be repaid. Medicare also provides other sources of funding, so practice incentive programs for various things, service incentive programs, which potentially go directly to the doctor. But again, you need to understand what these payments are for and if they're paid to the practice, to the individual doctor, whether they're shared or whatever, and what your agreements say and what the legal implications are. And then you have grants, so for specific projects. You may have some sort of funding from businesses if you do employment medicals directly for an organisation, or even refugee medicals. Some organisations pay for those directly outside of Medicare. So again, ensure of what your obligations in compliance are with whoever you get funding from, and make sure that you're aware of the service agreements. If you have contracts with your doctors, what is the distribution of finance? And as I said, get legal advice. Then you look at your banking processes. What are the GST requirements? What are the tax obligations? Having a basic knowledge in this area is really important, and it helps you with decision making and, of course, understanding your obligations in relation to governance. As a practice manager, it's important to have a basic understanding of financial reports that are important in the planning and management of a practice. And so we're going to have a look at these now on the next slide. Thanks, Tara. Just briefly, again, haven't got enough time today, and I'm conscious of how quickly we're running out of time to go through this, but I just want to give you an idea. And, if there is more you need to know, put this in your personal improvement plan. If there are things you need to do, keep thinking about your practice improvement plan and what you're going to take away from this today. So I'm just going to look at some basic ones that are handy in even for a non-financial practice manager to get an idea of, and you can ask your accountant for these. I'm sure they will oblige. So a statement of financial position, a balance sheet or a statement of financial position, which gives a really good snapshot at a point in time of what the owner's financial value of the business is. So it outlines out your assets and your liabilities, and that will change. As I said, it's current at a point in time, and it changes based on incomes, expenses, and the changes in those sort of things. But it gives an idea. Okay, is the assets of the business hopefully greater than the liabilities, so that we know the business is viable. Cash flow, that's important from a practice manager's perspective, because the accountant, if you're not involved in finances, may talk to you about this. And this refers to the flow of money into and out of the business. Now, it's important to ensure that there's sufficient income at a time when expenses need to be paid, particularly wages, because they're a fairly regular and often a fairly decent expense on your expense list. If we're not banking daily, or if we're not batching Medicare regularly to ensure that our funds flow in on a regular basis and as often as we can, then we may not have enough money at the end of the week to pay the wages. So we need to analyse the impact if we change a time frame, for example, for receiving income. So we might move from fortnightly collection of service fees from our tenant doctors to monthly collection. So how will this impact our expenses, our wages, and our other regular expenses? So we need to have an understanding of the cash flow process and what decisions that we make and how that may impact that. Then we have profit and loss, which of course is a wonderful little statement that shows us, are we actually keeping our head above water here? So it records the total income and expenses for the business over a certain period of time. It might be a month or a year. The longer the time frame often gives us a more realistic picture, because 1 month might look like we're running at a loss, but we might have run at quite a big profit the month before. So it shows us, as I said, at a point in time how profitable the business is. Income less expenses equals profit or loss, and it's an indicator of viability. Then we have our budget. This is usually completed at the start of a financial year, and it looks at what our income and expenses are expected over the year, broken into months. And as I said, some months, if we've got fairly high expenses and no real change in income, may look like we are falling behind, but then, that will hopefully balance out over the year so that we end up with some money left after we've paid all our bills. Monthly reports on the budget indicate if the business is on track, though, to achieving its financial goals. Then we have what we call a break-even rate or ratio. And this is a handy little tool to calculate, to tell us how much income we need to generate. And this can be on a weekly, daily, hourly, or even a patient basis to ensure financial viability. So we do that by taking the total service fees, we look at the total service fees that are required to cover our expenses, and we look at last year's expenses and see how much it cost us to run the business, and then what were the service fees that we needed for that. Then based on what your service fee calculation is by the doctors, you could look at what the total income the doctors would require to be able to pay you those service fees, whether it's 35%, 30%, 40%, whatever your service fees are. So what is the total income required to generate sufficient service fees for you to manage your expenses over the year? Then you want to divide that by the number of days that the practice is open. If you're open 5 days a week, then you would look at how many days in the year that the practice is open. Obviously, remembering to take out the public holidays unless you're open on public holidays, and you would get a daily rate. And then from that, if you're open 8 hours a day, you could divide it down to an hourly rate, and you could also even break it up per doctor and look at, what that would be. If you know your how much you generate per patient, what fees are generated per patient, you can then work out with your daily rate or your hourly rate how many patients you'd have to see a day or an hour to actually break even. So it's a handy little tool to have. It's also really good if you're trying to incorporate a new service. So you look at, the cost of that new service, wages, equipment, admin costs, whatever, and then how much would you need to charge to cover the cost. Next one, please, Tara. So then we have our operational plans, and this is where we get more specific. As we say, it's our day-to-day. It's where the rubber hits the road. This is what we need to do on a day-to-day basis. So our standard operating procedures, and they, as we've said, all the way along, all step back to our business plan and our strategic objectives. And this is part of your role as a practice manager to ensure that the daily operations are meeting the strategic objectives of the practice. What has to be achieved, what daily tasks are going to take to achieve this, and who's going to do them, who is doing what, who is doing it when, and who is doing it how. So the key performance indicators we can develop around these to know whether our goals and our actions are being achieved. So, for example, if we have a strategic objective to be more sustainable in our practice, and so we have a SMART goal that might be to reduce the amount of landfill from our practice by 25% within the next 6 months by increasing recycling and composting and reducing overall waste. Okay, SMART goal, part of our strategic objective, we're trying to be more sustainable. So what is our action and our operational plan? That is, we might have policies around this. So we ensure that we have 3 waste disposable bins clearly labelled for recycling, organic and general waste in each doctor's room or in each staff area or wherever you wish to do that, whatever your process says. And then staff have a process for collecting and separation of waste and ensuring it's disposed of in the correct collection bin. Okay, so that's your operational plan. Who's going to do it? How's it going to be achieved? And that goes back, as you can see, to your strategic plans. We will need to review operational plans fairly regularly to reflect any changes in the organisation, the staffing, that sort of thing. Okay, so once we've developed the goals, it's critical that everyone's on board and hopefully you've involved all your staff in the process, and we need to make sure the plan is communicated. You can, again, display your goals somewhere in the practice, discuss them at staff meetings regularly, and one of the standards, as we said, says our practice evaluates its progress towards achieving its goals. So it's really important that they have kept front of mind, not just typed up and put in a lovely folder in the practice manager's office. We need to discuss them regularly, and then the actions of our staff will indicate to us whether the goals are understood or not. How do we know we've been successful? We will have our KPIs in place, and we need to have a process for capturing that information so we know if we're on the right track. So customer service is one of our goals. Is there a process for, reporting customer service and observing it, getting feedback and that sort of thing, so we know, are we on the right track? And do we have a contingency plan? Do targets need to be modified? Some of them can be modified along the way because we notice we're going off track. Is there some sort of interim action, or is there a total corrective action? If you review them more regularly, you're less likely to get to the end and find you are well off track in the, throughout the whole process. So look at regular reviews and gathering data to see that your plans are, are heading where you want them to head, and put preventative action in place to get you back on track. Next one, please. Sorry, I think we're one behind. So that's what we want to do. We want to keep going. And the next one. So what are we going to do for our practice improvement plan? Have you had a think about that? Sorry, personal improvement plan. Skills for planning. Is this something you have already as a practice manager? Being able to manage our project effectively. Do we have good communication skills? Do we have risk analysis skills? Have a little look at your skill set and see if you feel that you have the skills here for this. So being able to collect and analyse data, basic financial reports, those sorts of things. And the next one, please, Tara. And this is just some suggestions for your in-practice improvement plan. So I'd like you to have a little look at, what we've done today that may be helpful for you to take back and implement into your practice. As I said, learning is not much good if we don't, take something from it and put it into place. Then have a look at your improvement plan. On the next slide, I've given you some ideas that might be, if you can move that slide, thanks, Tara. There might be some things there that you think, oh, I need to know more about. I need to know more about organisational skill, or I need to develop more organisational skills. I need to know a bit more about governance. So have a little look at what you're going to put in a personal improvement plan, and then have a think about how you're going to get that knowledge. Now, there will be a survey after this where you can have a little look at, things that you can put into place, suggestions of things that you wish to learn. Next slide, please, Tara. I have some resources there if you want to perhaps take a screenshot or a picture of that, or it will be in the slides as well. Just some things that you might want to use in your planning process. And finally, are there any questions? I'm not sure whether anything's come into the chat or not. I know Julie's going to
have a look. I've seen some questions around can we provide business plan templates?
There was a link in the resources there. Yeah. I believe the accreditation agencies do have some templates. You can always ask from, they often have resources around that area because that's one of the requirements.
much the main questions. But as you said, Tanya, all the links and everything will be sent out in a post-webinar email, a link to the recording, which has the resources in there as well. We will also list the following webinars that are upcoming. And as you mentioned, Tanya, they're fantastic for ongoing education. As we all know that's a standing accreditation requirement. But I'd like to thank you for that fantastic, informative, practical information to help practices in their planning and operations management, not only for their day-to-day running, but also to meet accreditation requirements. So next slide, Tara. So we would love you to fill in our QR code today. This is really essential to help us in effective planning for webinars, to know what practices want. So if you could fill that in for us today as well. Next slide, Tara. And this is our next webinar, which is coming up on Wednesday, the 27th of August. In the post-webinar email from today, we will also send out all the links to the upcoming series. So I'd like to thank you all for attending today. And I don't know, Tara, if you want to maybe just go back to the QR code, just to make sure everybody gets a couple of minutes to look at it. But thank you all for attending. Thank you, Tanya.
Thank you.
Thank you.